So elaborating about more misconceptions that people might have. What do you think about whitening? Since I've heard so many opinions talking about this.
Well,
part.
actually, behind the scenes, you were telling me
exactly.
that you don't want to do whitening. So you told me backstage, like I said, that you think whitening is like layering of the teeth.
It's like, again, as the environmental activities. Like, it's not that way, but let's say you're putting a layer over your teeth, which is not your real teeth. So it's a fake thing. So that's what I believe, to be honest. But
that has nothing to do with whitening. You're not putting a veneer or a composite
I got
material.
it, but it's a pigment.
No, it's not. Whitening is just like, it's using natural, products. It's a hydrogen peroxide or hydrogen carbamide. What just removes the staining that you have. So of your teeth. So your everyday
over
coffee.
The years,
over the years that you have, smoking. I would say people have this misconception like, I really don't want my teeth that white, right?
Yeah.
Whitening only makes your teeth as white as what your natural teeth were,
That'll
right?
be fine. That will be fine.
So when people say like, I don't want it too white, if your natural teeth are white, it's going to get white. If it's not,
it's going to be the same thing.
And if you want it whiter, then I would say, I advise them to get veneers or composite bonding because you can't get it whiter than what your teeth were originally. Like everybody says to me, like, your teeth are really white because my natural teeth are really white.
Are white.
Yeah, that's it. It's not because I do anything
it's not fake
else.
thing.
No, it's
like,
not fake. I don't have veneers or anything like that. So it's just my teeth. So this is the thing. You're not layering anything. You're just putting on peroxide. And it's just going through the 4 layers of the tooth to make it, to get rid of, I guess, the staining. So you're not putting anything on.
So another question from a common person, not a dentist.
It's fine.
What is the difference between fluoride and whitening? For me, I see this the same thing, but it's like different shades, for example. That's what I see.
Fluoride and whitening is completely 2 different things. Like fluoride is what your teeth need to protect itself from having cavities and sensitivity. So it just remineralizes the enamel. Whereas whitening whitens and removes the staining. So there's nothing that's the same. They're 2 different things.
I guess I got this perspective, or let's say stereotype, just because whitening is usually connected to the cosmetic dentistry. So that's how I got it.
In a way, yes, it is connected to the cosmetic aspect of it, but it's more of the natural way. Because if you want teeth that are white and you don't want to do cosmetic, as in veneers, then you would do whitening because it's your natural teeth. You're just removing the stain. And I think the fluoride you're talking about is this. This is, of course, my opinion, and a lot of people agree. Is there's people who are like, environmental friendly, or it's something I would say fluoride is very toxic, and anything too much is toxic. Too much water is toxic. Too much air is toxic, right? So it's, how do I say, you don't get that much from toothpaste that protects your teeth to have a toxic level. Like you probably need a gallon of it, okay, to have a toxic reaction, right? So I always think it's like kind of a tactic for the pharmaceuticals or the companies that have toothpaste, for people who kind of have that, mindset that, fluoride is bad for you. So it's like, okay, so we have a toothpaste that you can use without fluoride. So that, okay, I'm going to use non-fluoride toothpaste because why else would they make it? Right?
True.
But they make it as a marketing strategy.
I got it.
Right? Because you would buy it because you're against fluoride.
So I'm going to buy it.
I think it's the marketing strategy because fluoride is there to protect your teeth. Right?
So maybe
it's to prevent it.
You need to change the fluoride propaganda to make it more...
Yes, because a lot of patients who I've seen who don't like fluoride, especially for their kids, they have a lot of cavities. Right? So now... what do you do when you have a cavity?
So why is it when I have a cavity?
If you have a hole in your tooth, you would fill it. Yeah. That's now a foreign substance in your tooth.
Because it's necessity. It's different. It's
not
cosmetic. I'm going to add something.
That's hypocrisy.
Why hypocrisy?
Because you don't want to do something that's beneficial to you because it might be toxic. But wouldn't something that would be foreign in your mouth be toxic?
Different levels, like different levels of being normal person, human being, and the other level is being good-looking person. Like it's a different thing. When I add a layer,
but then again, it's picking and choosing, right?
Picking and choosing depending on necessity. Let's say.
Of course, but who makes necessity? You do, right?
Yeah.
So you would rather not have something that's good, beneficial to your health.
I'm going to lose my tooth that way if I didn't fix it.
Yeah, but you've created now and damaged your healthy tooth because of this propaganda that fluoride is bad for you. We have fluoride in our body. It's a natural substance. right? So you won't take something that you already have, but you'll put something foreign when the problem is there. So it's like, why wouldn't you prevent dental hygiene or treat?
Makes sense.
Right? So this is a conversation I love to have with people. It's a huge debate, but it's not just with you. It's a lot of dentists, you know, say, no, I don't want to give, you know, fluoride, or a lot of hygienists. It's a controversy, you know, there will always be fluoride, no fluoride debate. You know, actually in school, when I was in university, we had a debate. So our professor split us in two and said, create why we should be for fluoride and create why we should be against fluoride.
So the debate.
So there's a debate because there's always going to be two sides to a story, or two sides to whatever, because everybody has their own opinion, right? So, but like I say, too much of anything is toxic. So if something for me helps me, if I take it in low doses, why wouldn't I prevent something that's going to be worse for my teeth?
I got it.
Because then you get to keep your whole bone, your whole tooth structure.
A small personal silly question.
Yeah.
Why is it always connected to the kids, not for elders, like adults?
No, adults do take fluoride, okay? But we say for kids as well because of their eating habits. And how they brush and how much bacteria is there, and to prevent it from happening. And we try to do it because children start having their adult teeth come out at 6 years old, right? But their dexterity and they're not very, you know, good at cleaning their teeth. So we're trying to protect their teeth, because after their molars come out, you know, at 6, there's no other tooth that can come out and replace it, right? Like you got to have that now for the rest. So we're trying to help them, but adults need it as well. Yeah. So if you are cavity prone, you should have fluoride. If you have sensitivity, you should have fluoride, right? So I have fluoride. And you know what's funny? I've never had a cavity in my life. Oh. And I'm saying this on camera. I've never had a cavity in my life, not one. I've never had a filling. I've had we do the Fisher sealants for children on the molars to kind of, you know, the little pits and grooves in our teeth. They've covered that when I was a kid. So, but I've never had a cavity. Wow. Right? So I could be a walking advertisement, right? For saying fluoride helps. Of course, right? But I'm not saying that if you take fluoride, you'll never have a cavity. That's not what I'm saying.
It makes it just less possible to happen.
It helps you, right? So it's like you're less prone to have cavities, because cavities can be genetic as well, right? And of course, if you have fluoride, you're not brushing well, or if you're brushing and you're not flossing in between your teeth, you're gonna get it, because people love to brush well, and they say, "But I brush 3 times a day, Maria. I brush 4 times a day." Yeah, but the interdental space, you're not cleaning it. And listen, bacteria after like 40 hours, 30 hours. It's good bacteria, right? But after that, it turns to bad bacteria. So then it starts attacking you. Okay? So we don't say like, keep brushing, because excessively brushing is bad. You know, when people say, should I use mouthwash every day? No, because actually that kills good bacteria, right? But because your mouth needs it. It needs to help with the pH. It needs to help with, you know, protecting your teeth from acid. So I said that we have good bacteria. But then that same bacteria, if you leave it turns bad. It turns back in a bad way, But the problem is when you remove it, that bacteria is constantly growing. Biofilm is the biggest bacteria in the world that you will never be able to contain. So we can say it's more about how you clean your teeth, not about how many. It's about how you do it. Of course, hygiene. Hygiene is what matters. You know, you get addicted to it. So I use an interdental brush. You know, I use a water pick. I brush, but I take that 5 minutes so I don't have to pay about, you know, $1,200 to $5,000 to fix a tooth, right? So, and it's all mine.
True.
Right? So I can say loud and proud, and you know, I can't say I'm a hygienist and say, guess what? I've never had a cavity.
You, as Dr. Maria, that you speak more than 5 languages.
Yes.
So I guess like saying German, English, of course, English, German.
Yes, I do speak English.
By the way, guys, like Hindi, Urdu.
Yes.
What else? Persian.
Yes, Farsi.
Farsi, yeah. So it's more like 5 languages. And you even told me that you were going on.
So I have a 6th one, but it's ASL. So it's American Sign Language. So American. But I did that when I was in school in Canada. But what's the question?
The question, yeah. The question is, how does that thing help you to engage with the communities in Dubai?
How does language help me?
Yeah, since like it's a very cosmopolitan city to be living in Dubai.
That's clear, right? Like speaking any language, I think if you're bilingual or multilingual, absolutely helps you, right? Because you get to start communicating and connecting to patients on their own language, right?
Yeah, that's really
so for me, especially in Dubai, Hindi and Urdu are working out perfect, right? Because you know, it's something that's amazing that for me, like everybody's like, what? Like, what are you? And I'm like,
how did you get that? Like,
you don't know why. But you know, it's just funny. It helps a lot, especially even with my patients at work, you know, when there's a language barrier or, you know, they're Indian patients or Pakistani. And I tell them, they come, they're like, you know, I had one patient like, you know, my niece saw you on the website and it says that you speak Urdu. He's Pakistani. And I was like, yeah. And he was like, can you actually speak it? I was like, yeah, I can. So I started speaking to him, you know, and, you know, he did all his treatments that were required and he felt comfortable.
Of course.
Because obviously, first of all, English is one thing and then dental terminology and explaining that it's more complicated. But in here, I see a lot of my patients that come, I have a lot of German and Swiss patients. And when they come and, you know, sometimes, you know, the language, they don't know the word. And I'm like, do you speak German? And they're like, yeah. And then I'm like, let's do it. And you could see they're just like there's a sigh of, okay, she can understand me. So for me, it's more about, the patients feel more comfortable. It's like me when I would go to another country, when I first moved to Germany, before I learned German, when somebody would tell me they speak English, because not all my colleagues spoke English, right? So when someone said they spoke English, I felt a sigh of relief. I'm like, someone I can talk to, right? Someone understands me. I don't have to like say things or whatever. So it became, it's amazing. Amazing that, I sidetracked, sorry. I just blabbered about languages. But the way it helped me, again, with my patients.
But how do you learn all these languages? It's like so different languages, from Hindi to German to English. It's so
to be honest,
away, even
okay, so my background is Afghan Canadian. So I do come from my parents and mother tongue is Farsi. But obviously raised in Canada,
okay, so that's one
my other tongue would be English. So at home we say Franglish. So it's like Farsi and English mixed together. But that's just, of course, common. And on top of that, I did know a bit of French because Canada is 2 languages. So it's English and Quebecois French. Yeah. So that was one. And then when I started to move to Germany, I didn't go to school, actually. It's like, you know, this is the reason why I didn't learn Arabic in Dubai. Because
that was about to be my second question, by the way. You've been living here for more than 10 years, I guess?
Back and forth. No, not
back
right now. It's like, for 4 years. Yeah. But I'll tell you why. Because you don't need to speak Arabic in Dubai.
That's one thing.
That's the problem, right? In Germany and in Switzerland, even if people speak English, they want you to speak German.
I got it.
And I don't blame them. You're in their country, right? So when I moved there, it was so hard for me because German is not an easy language to learn, right?
Definitely.
It's very difficult.
Yeah.
So for me, it was like when I went there, I started reading baby books, like children's books, Duolingo.
Oh, all right.
That was an app.
Yeah.
And I started watching movies and anything that I watched in German with English subtitles. And when I was in Germany, I didn't know I spoke German because I wasn't comfortable enough. Yeah.
Oh, okay.
So
just have in mind. That's it.
Towards the end, before I left, I started, you know, speaking to my patients a little. But when I moved to Switzerland, where my environment changed, I got this confidence. You know why? Because when I would be watching something or, you know, would be on the train and people are talking, I would understand them. And I'm like, I understand everything they're saying, you know? And when then I would go to the grocery store and I would, you know, and it literally was just...
You can communicate normally.
It just came out.
No barriers,
And I just started being fluent. And it was because of my environment, what forced me, and my position to make sure I can communicate on my own. Because everything is in German there. Your bills come in German.
Oh.
The banking is in German. I mean, you can request for things to come home in English, right? But majority of the stuff that come are in
It's just getting affected
German,
in your, like,
right? You're just like, what is this?
Injected in your mind,
right? You're like, what is this? So that's that. And Hindi and Urdu, I would say I learned it from movies.
Movies.
Bollywood, amazing,
Oh.
right? Bollywood's amazing. And,
I wasn't expecting that.
Yes, I love Bollywood. And it's, I guess when you're a child, your brain is like a sponge, of course, right?
True.
So when it was around me, it's such a weird thing that watching it and watching it and watching it, you just learn the language. It's like the Netherlands, you know?
Yeah.
My cousins are there. Everything on TV is in English. They don't translate it into Dutch. So that's why majority of people in the Netherlands speak English.
I hear even that they're more fluent than people in
Yeah.
Britain. I've heard that thing for real. Like,
And that's because as
Yeah.
children, they're watching everything in English. So that's why I was like, why are my cousins speaking so perfect? They speak Dutch. It's because I
Wow.
realized that everything is in English. They don't translate it like they do in other countries. So they learn 2 languages right away.
just like you said, your mind is sponge.
Yeah, but that's the reason I don't speak Arabic, because in Dubai, everything is
It's in English.
In English.
Yeah, you have 2 options all the time. So yeah.
You
I
need
would
more
tell.
English than you need Arabic.